So welcome everybody. I'm going to call the meeting to order. It is now 5:36 p.m. and we'll start with the roll call of board members. Dr. Scott McNeil.
Here.
Dr. Hamid Ismail.
Yes.
Dr. Jennifer Ibrahim.
Here.
Dr. Marla Gold.
I'm here.
Dr. Tyra Bryan Stevens.
Here.
Dr. Ana Diaz-Rue. Not here. And I'm blocking for a second. My apologies, everybody. Then who am I forgetting?
John Rich.
John is actually rotated off the board.
Okay.
I think you've covered everyone then.
Okay, thank you. Oh yes, I'm not counting myself. My apologies, everybody. All right, so I'm going to turn things over to Ben for an explanation of the public comment process.
Good evening, everyone. My name is Ben Hartung, and I'm a public policy advisor for the Division of Chronic Disease and Injury Prevention of the Department of Public Health. And I'll be facilitating the written public comment process for the meeting tonight. So if you would like to submit a comment on anything the board discusses tonight, please use the chat function of this webinar, and I will send a message in it shortly that should appear to you all to indicate where you can send your message to the board. You could also send the message to me by email, and I will forward that along to board members to review. My email is Benjamin, BENJAMIN .HARTUNG Hartung @phila.gov. And any comments we receive tonight will be passed along to the board members who will review them before making any votes tonight. The board members do not have to directly respond to any comments at this meeting, but they are required to review them before they make a vote. And so I just wanted to let everybody know that, and that also this meeting is being recorded and will be posted online afterwards pursuant to the Philadelphia Code. So if you choose to participate in the meeting, know that you will be recorded and it will be posted online. With that, Dr. Bedigal, I'll put it back to you.
Perfect, thank you, Ben. And my apologies, I'm off camera because my camera is malfunctioning tonight, so sorry about that. So I'm now going to just review tonight's agenda. First will just be a vote to adopt the meeting minutes from December 14th, 2021, and then also a presentation of the report regarding the response to comments received on emergency regulation governing the control and prevention of COVID-19, mandating vaccines for individuals working and dining at indoor dining locations, and adoption of final version of emergency regulation governing the control and prevention of COVID-19, mandating vaccine for individuals working and dining at indoor dining locations. So first, I just want to ask if the board has had a chance to review the meeting minutes and if there are any questions.
I'd like to move to approve them.
Thank you.
Second that.
All in favor?
Aye.
Aye.
Any opposed? Great, thank you. So next we'll turn to the report. So I think we have Joe with us to present the report.
Yes, and I can share my screen in 1 minute for everyone.
And I know that you all have had a chance to review the draft report and to send your comments as well.
Evening, this is Jo Rosenberger Altman. So I'm just going to explain a little bit about just the structure of the report, and I'll ultimately leave it to Dr. Bedigal and all board members to the extent you want to refer to specific responses to comments that were made. hold
Ben,
on.
I think your email is up. Yeah.
Thank you, sorry.
Okay, so the report just basically provides a procedural background explaining the history of the regulation and regulatory process this regulation has followed. There's a brief description, a very brief description of the emergency regulation. There's a brief description of legal authority for the regulation. And then there is a summary of the December 23rd, 2021 hearing that includes responses to testimony that was provided and written comments. I'm not going to repeat either the testimony or the proposed response that the Board of Health has put together, which I understand incorporates some feedback from individual board members. But obviously each of you will need to have reviewed that and be comfortable with it. If the board would like to highlight any particular responses, that is certainly appropriate for them to do, each of you to do. I'm just going to go then past the responses, the comments and responses, and note that the final action, which is just one small change, I think that was realized when processing the comments and responses by the Board of, proposed by the Board of Health, that there was a realization that one aspect concerning the optional exception for testing prior to January 17th was unclear. So on the very last page of the report before exhibits, there is a section that identifies one small wording clarification to clarify that the exception that allows for restaurants to accept testing prior to January 17th, 2022 applies to customers of the indoor dining locations. And there's two wording changes there that you can see, and that is the substance of it. And those are the only changes being proposed by the Board of Health, by the Department of Health at this time. There's also exhibits, the original regulation, the transcript of the hearing, and the the letters requesting the hearing, and the copy of the final emergency regulation, a clean copy with the changes reflected in the final action section reflected on the regulation, are attached as exhibits.
Thank
Turn
you,
it back
Joy.
over.
Thank you. And I also want to note that Dr. Ana Diaz-Rue has also joined us. So thank you for being here. So before we turn to any additional public comments that have come in, I just wanted to take a minute, since we do not discuss things by email. I know you had a chance to individually email comments, but if there's any discussion that the Board of Health would like to have. Okay. And I believe at this point we would turn to any additional public comment that has come in and give the board time to review that. Ben, do we have any additional comments?
I'm not seeing any comments in the chat function right now. There was a request in the questions to have this report emailed out, and I will note for the public that this report, if adopted by the board, will be posted to the Department of Records page for public consumption. So it will be available for your review.
Great,
And
thank
just
you.
to clarify, you sent public comments that were submitted earlier via email, correct?
Yeah, so I will point the board to an email. Thank you, Dr. Ibrahim, that I sent just prior to the meeting with 4 comments that were received throughout the day regarding the emergency regulations. So if you want to take the time to review those now, if you haven't had that time, please do so. And I do see that we're getting some more comments, so I will give the public a few minutes to type into the chat, or I see people are also using the questions function that also works. And I hope I'm being understood. I have one comment that my audio is poor, so I apologize for that.
Yes, I'm hearing you clearly. Dr. Ishmael?
Yes, there's a study that was just completed by the state of Texas on COVID deaths and cases, vaccinated versus vaccinated, was published November 21st, 2021. I suggest it's quoted in your responses.
Thank you.
I'll send it to Benjamin.
Thank you.
Thank you, Dr. Ismail. I did just receive that email.
I'm not seeing any comments from the public in the chat. Ben, are you?
We did get one in the question feature, and I can read it to the board now, and I also posted in the chat feature, but it states, what is the determining factor for the restaurants to return to normal service?
So just a reminder that members of the board can choose to engage with public comments or questions or not. I do want to note that Ben's audio is very clear to me. So for the viewer who's having trouble hearing, it may be on your end. Is anybody else having trouble hearing from the board? Okay, people are saying no.
We're hearing very well.
Okay. Were there any of the emailed comments or questions that the board would like to engage in discussion with at this point?
We've received one more comment that I'll post into the chat. And I'll read it out loud in case people aren't able to see it, but it says, the new vaccine mandate is a prudent measure to help customers and restaurant staffs to feel safer when indoors in affected venues. Thanks.
Okay. So thank you very much. If there's not further discussion that the board would like to engage in, is there a motion to approve the report with the addition of the reference that Dr. Ismail had suggested?
I just want to add, I'm sorry, if there's an addition that Dr. Ishmael has suggested, I think we need to state specifically what language is being added to the report. I apologize for that. I know it's a little hard to do that kind of in the context of the meeting, but I think that is important.
Okay.
Yeah, apologies.
It's, if I may, it's a reference to support the statements that vaccines are effective. The unvaccinated from September 4th through October 1st, 2021 in the state of Texas, unvaccinated people were 13 times more likely to become infected with COVID-19 than fully vaccinated people. Unvaccinated people were 20 times more likely to experience COVID-19 associated death than fully vaccinated people. And it's an important thing that this data are coming from the state of Texas.
Thank you. And could you, or could Ben or someone identify the site for that so that when there's a motion to amend the report to include that language in the report, that is clear? I apologize for the technical
Sorry,
request.
Ben has received the report. It's the summary of the report on the second page. The report is dated November 8, 2021, Texas Department of State Health Services.
So Joe, are you asking for where in the report to add that?
I think that would be great, but I'm really primarily just making sure that the exact language that Dr. Ismail would like added is clear on the record, so that we can get that accomplished.
Yeah, in the report, there was a reference to a site I provided. This is more credible site than the one I provided. It's a written report and issued by the Department of Health of State of Texas. So it could replace that citation that I provided. In the report, there is a comment referring to a citation I provided.
Okay,
So
thank
it
you.
replaces that citation. You don't need to change the text in the document. It supports
Perfect.
the text in the document.
Perfect. And can Dr. Ismail or Ben, could one of you identify what that site is that this is replacing so that we can be clear on the record about that?
Yeah, it is on page 19. It says vaccines have been shown to reduce the death rate from COVID-19, citing reference 31. And 31 is a reference of our world in data. I think the Texas Department of Health report is more solid. It's a document instead of a website, and anyone could download it from the Texas Department of Health through Google. So it replaces the reference number 31 on page 19.
Yeah,
Wonderful. Thank you so much.
And Joe, I apologize. Did you have the information down? Because I'm trying to facilitate the meeting, and it's hard for me to do multiple things at once. But
Sure. I'm looking at the report, and you said page 19, but you said reference 31.
That's right.
So I apologize. On page 19, I'm not seeing a reference
Maybe
31.
we
That's my.
don't have the same report, but I'm referring to a version, and I quote the version that I received on Sunday from the commissioner.
So I think that the version that we're voting on is the one that just went out.
Yes.
And so that's why Joe had walked through just the, what the final
Okay.
changes were. So let's see if I can.
So I think it's reference 32. The CDC, the COVID-19 vaccines are effective. I think that's the reference to replace.
Yeah, it's also referring to death.
Sorry. On page 14?
Correct.
Dr. Ismail, is that?
I don't have the same version maybe, but let me just look at page 14.
So Dr. Ismail, you received an email from Jean Otis at 2:35 this afternoon.
I believe I found the citation. It's actually citation 47. And Dr. Ismail, is this the same language that Site 31 is referring to in your version? It says vaccines have been shown to reduce the death rate from COVID-19, and
Yes.
it cites to our world and data, as you said, right?
Yes. So
That's
that's
now-
the replaces. Yes.
Yeah, that's now citation
Texas.
47.
Sorry. Yeah, I think that is this reference that I would like to suggest to the board, propose that we put the State of Texas Department of Health Services report to support the difference in death rates between vaccinated and not vaccinated.
So are you saying add that report, add that as a reference? Is that what you're asking?
Replace the reference that was used to support that statement. The report was a website, not a report. This is an actual report.
Got it.
And it's on page 17 of this version, the one that Jean sent out today.
I think it's 21, page 21
Yes,
of this
page
version.
21. Yes.
Although Ben, I'm having I see I see it in the text. I'm having a hard time. Oh, there I see it. I see
Yeah.
it. It's in the response, the last sentence of the response on that page. There's a footnote to
Right.
40.
But Joe, it's
47.
also on page 17 as well.
Oh, thank you. Let's see
Thank
if
you,
there's
Dr.
anywhere else it is. I'm just going to do a quick search for it.
And while you're doing that, Joe, we are getting some more comments into the chat function here that I can paste into the chat. I know.
Wait, I'm sorry. Just a correction that it is not, it's a different reference on page 17.
Yeah, I'm not seeing it there. Dr. Ibrahim, I think Dr. Ismail was referring to a different source than you were thinking. I think the one on page 17 is a CDC website, and
No,
he
we're not
was
releasing that. I don't have the latest. I'm checking Jean Otto's email. I'm not getting the latest version from her, so I can identify it very quickly. So
Okay, I'm going to forward, I will forward it to you just to make sure
Thank
that
you.
you.
Yeah, can we also confirm that all the other board members have the most recent version?
The one that was sent at 2:36 today.
Yes. Okay.
That is the most recent version, yes.
And I think it would be prudent to allow Dr. Ismail a few moments to review to make sure there aren't any material changes that might affect his vote. Just
That's
I
fine.
don't have an email from 236, so somehow my name was missed. Once I receive it now, I'll identify it.
thank you
Okay.
so
I just
much.
forwarded it to you.
All right, I see everyone else's name here. I think Jane inadvertently left you off. I'm sorry about that.
And Ben, did you say you're adding the comments into the chat?
Yes, are they appearing for you?
Okay, there they are.
They are now.
Yes, it's reference 37. That reference is to be replaced with the state of Texas report, which confirmed the same statement. But I suggest or propose that the state of Texas report of November 8th, 2021 is real data from the field in the state of Texas related to difference between in death rates and also cases between vaccinated and non-vaccinated, which shows that in real life, in that state, the vaccines are effective and they prevent death.
I'm sorry, did you say footnote 37 or 47?
47.
Thank you.
Okay.
47. Awesome.
Yes.
Thank you.
So, Dr. Ismail, I don't know if you would like more time to take a look through there. I know you have read earlier versions, but.
Yeah, I read it. It's the statement on page 21 that says vaccines have been shown to reduce the death rate from COVID-19. There were claims made that the vaccines are not effective. The vaccines have been shown to reduce death rate from COVID-19. The reference is 47. So
Okay.
I'm proposing changing the reference 47, which is a website, to the state of Texas reference, which is real life data from the state of Texas on the difference between vaccinated and unvaccinated, both in cases as well as in death,
Okay,
which confirmed the statements made in the report that the vaccines are effective and safe.
okay, great, thank you. And I see that there are a few comments. Please let me know if any members of the board would like to discuss any of the comments in the chat. Is the board comfortable taking a vote on the report at this point with the changed footnote that Dr. Ismail has suggested?
We should probably have a motion on the amended footnote and then vote on the final report.
Is there a motion on the amended footnote?
I'll make the motion.
Thank you. Is
Second.
there a second? All in favor?
Aye.
Aye.
Any opposed?
Aye.
And on the report itself with that amendment? Is there a motion?
So moved.
Second.
All in favor?
Aye.
Aye.
Any opposed? Okay. Thank you all very, very much. We can now, I believe, Joe, tell me if I'm making a mistake here, but I believe we can adjourn this meeting. It is 6:02 p.m.
That's correct. Thank you.
Thank you all very, very much for your time and for your dedication.
Thank you.
Thank you.